Thank you very much. Thank you. I have to say, I have been looking forward enormously to this evening. Last year, when we came here for our first visit, we discussed complaints and consent, and I can measure the success of that event by the fact that someone complained about it to the General Osteopathic Council. I love being seen as a disruptor. Now, you're probably curious to know what that complaint was about. Well, in one of my emails beforehand, I used the subject line, complaints, consent, and sex with patients. Well, obviously, that's an outrageous idea. Of course, if they bothered to read the rest of the message, they'd have seen that what I wanted to address was the thorny question of when exactly is it okay to start a relationship with someone you've met over the treatment table, which is a bit less controversial. And, nobody can rule out that you might first meet the love of your life when they come to you as a patient. I'd love to update you more on that complaint, but it's still with the General Osteopathic Council, I'm afraid. I have to say I will be delighted if they took it further, because it is so clearly an idiotic, malicious complaint that I think it would benefit from being exposed. But we'll see. So, what we have to do this evening is see how we can provoke the pure and righteous this year. I think I've missed a trick, because I could have used the title Thrusts, Force and Smacking Patients' Bottoms, because that kind of does encapsulate what we're going to do this evening, as you'll see a bit later on. But I only thought of that this evening in my hotel room, so it was a bit late. What I've done is I have brought Professor Laurie Hartman down here to Swansea this evening. If you're an osteopath, then I'm sure you'll know of him, even if you haven't actually met him in person. If you're a chiropractor, it might help to say that he is one of the most famous names across the world in osteopathy. Donkeys years ago, he was trained in what I personally think is wrongly called minimal leverage technique by a chap called Mr. Middleton. He's the guy who invented the technique. Later on, though, the baton was actually passed over when Middleton admitted that actually Laurie was now better at it than he was. Laurie, always a delight to have you on the show, always a delight talking to you. I'm going to start with an apology, because you had to put up with talking to me for 4 hours in the car earlier on, and now you've got to do it for another 90 minutes. But yeah, welcome. Great to have you here.
No problem. I'm going soon.
I don't want to waste time, because we've got quite a lot to get through in a short show, but can we start first of all with just a little potted history of Laurie Hartman, just to know, where you began as an osteopath and more recently what happened to you?
Yeah. I qualified in 1964, before a lot of these people were born, basically. And
I was 5.
Yeah. And at the time there were 209 osteopaths. Now there's 7,000 or 8,000 in England. So the profession has grown dramatically. Yeah. And I went into practice. I was working for other people who, I worked for a doctor and lots of people who were osteopaths as well. And they were terribly busy. And I had to see all the acute patients. So it made me very good with acute patients, because that's all I saw. Yeah. And as my practice grew, then I left them and went to work by myself. And I worked by myself for about 20 years. And then I had a severe accident. I was spraying a wasp nest in the loft, and I climbed the ladder.
A ladder outside the house?
Outside the house, which was 2 floors up, and for some reason the ladder collapsed, and I came down, hit my head on the left side, and that was nasty, because that was caved in, dislocated my left shoulder, fractured my T12, and I was flown to hospital by helicopter, and they gave me 1% chance of living. They operated, they took away the skull, they shoved it in my abdomen, got a nice scar there. And when I did survive, they then put the bones back again. I'm shortening this dramatically, because it was 5 months I was in hospital. And in the end, they did a third operation. They replaced that side of the skull with metal. Right. So there's metal around there, and 7 by 5 centimetres my brain has gone.
What did they do with that bit that was in your abdomen?
Oh, they took it out, and I think
not still there.
There's still a bit there, yeah. That was interesting. And the wife came into the hospital with my book, which I'd written long before that, and she said, "What's this book?" Didn't know. And I flicked through the pages, and I had a sudden incredible pain in my head. I thought, I'm going to die. And in fact, it was my brain re-establishing everything, and like that, it came back, everything. Yeah. And I could tell what's on each page. And the funny thing is, when I came out of hospital, I had to learn to walk again and everything. And I came out, I didn't work for about 3 months, and gradually she said, right, you're back to work now. And patients came in, I'm flicking through the book looking what to do, and they all got better without me thinking about it, because the part of my brain that was working the logic had been damaged.
Yeah.
And that was how I started back into practice. And I practiced in London for a bit, and my father had died beforehand, my mother then died, and the surgeon said, move out of London, get away from the hassle. So we did. We moved up to Norfolk, which is fine. We lived in a little village with no shops, no pubs, nothing. And that was fine. Now I can cope with it. But,
Do you know, the main reason I mentioned that is because, first of all, I think it's really dramatic, that whole sort of flash of revelation. I mean, you can remember the whole of your textbook. But also, and this is relevant to the conversation we'll have now and during the course later this weekend, you have lost a certain amount of short-term memory, haven't you?
Yeah.
So that means that sometimes you lose the thread of a question.
Yes.
But also sometimes you might repeat yourself.
Yes.
And what I don't want is for anyone to get the impression that this man doesn't know his osteopathy, because he really, really, really knows his osteopathy. And so that brings us to your technique then, Laurie. So we're going to talk about high velocity thrusts, aren't we?
Yeah.
And there is a lot of controversy. There has been a lot of controversy recently from some quarters, including osteopaths, saying that we shouldn't be bothering with them, that they're no better than exercise, or exercise is better. What's your take on that?
When I sold my practice, there was 70,000 patients on the list. You don't get that number unless you're getting results. And I did have results. And it was always quicker than anybody else, because I was finding the right point and applying a short, sharp thrust. I did a lot of soft tissue and articulation, and I gradually shortened the time of my appointments from an hour to 30 minutes and eventually 15 minutes. Patients in 6 rooms, they were in, they were ready. I walked in, treated them, walked out. And I didn't get after effects, after reactions. I got very good results. If they weren't suitable for thrusts, I had 3 or 4 people working with me, which in those days was very unusual.
Osteopaths?
They were osteopaths, and one doing acupuncture, one doing homeopathy and so on. And this, that was very successful. And if I wasn't allowed to do thrusts, I couldn't get patients better, because it's mostly what I did. I was thrusting accurately. I did a bit of soft tissue, articulation and so on. But the main work was ultra-accurate thrust with minimal force.
Right.
And that's what I learned at the BSO.
Yeah, which is why I think this title is wrong, because actually, as you'll discuss this later, I know, but it's not the leverage which we're cutting out in this, is it? No. It's the force or the amplitude of the thrust itself, which is what makes it so safe.
Yeah.
But I remember a colleague of mine when I graduated, which was only 25 years ago, he went into practice with another osteopath, and he was told, you'll get patients, you go in, you adjust this joint and you adjust that joint, and that's what you do. And the appointments were very short, and it was completely alien to what we'd been taught at college. But it sounds a bit like your 15-minute appointments to me.
No, at the end of 15 minutes, the patient would look on their watch and say, aren't you going to do more than that? And I said no, because if you're going to a dentist and he's finished drilling after 5 minutes, you don't want him to carry on. He's going to stop. And mine's the same. I'm doing what's necessary. And they came back the next time. I don't know what you did. The last chap was doing loads of rubbing and I wasn't better. You've done that and I'm better. So what are you doing that's different? And it was just the accurate thrust that makes the difference. And accuracy is important.
Yeah, but I think the point I was getting to there is you weren't going into each of those 15-minute appointments saying, before you even go through the door, saying, these are the things I'm going to do.
No.
In that 15 minutes, you had time to work out what was needed and then to do it.
Yes, New patients had half an hour to take the history, look at them and assess what I was going to do. Well, once I'd seen them, 15 minutes was sufficient.
Yeah. Okay. Was there anything else? Did they then go and get soft tissue, or did they...
My wife is a massage therapist. If they needed that, I'd send them to her.
Yeah.
But normally they either came to me or her. They didn't choose.
Yeah. We had an observation that came in 2 days ago, actually, from Matthew. He says if it helps to have an argument on the other side of this particular coin, he believes HVTs are definitely dangerous, and he's seen many cases of complications post-HVT, thankfully only 2 from himself in 20 years. and the profession would be a lot wiser to acknowledge that it is dangerous, although relatively rare. Matthew would further argue, or further add, that the danger can't be mitigated purely by skill. There are situations where skill will not avoid aggravation or cause an injury, and he says he could go on, but he does think it's important just to stress that even osteopaths and chiropractors can have different opinions on the idea of what is dangerous. He says, feel free to put this forward, and use his name as well, which is good.
I think in some ways he's right. That's why we have 30-mile-an-hour limits, and everybody has to stick to 30, and if you do more than that, you get done by the police. Why do racing drivers drive at 180 to 200 miles an hour, that close to the car in front, and get past them, and they very rarely have accidents, and they're driving on the limit? The police chase people, they drive very fast. They're properly trained. And I think if you're properly trained, you can use thrusts with no problems. Out of the 70,000 patients on the list, 2 I know were worse. 1 wouldn't come back. He went to a surgeon. The other was my sister. I was trying to get a bit of her back. I lay her on the side, and as I leaned on it, pop, the disc went. And it can happen. But 2
So
out
you
of...
hadn't actually thrusted at that stage?
No, I didn't.
Right.
2 out of 70,000. That's not bad.
No.
And if anybody gets anywhere near that, they're doing pretty well.
Yeah. Tim, again, this came in before the show. Tim says he would encourage those that follow this presentation, let's go off my screen again, not to assume... Somebody's going to fiddling around with my questions here. Not to assume that adjustment techniques used in the context of traditional or classical osteopathy are placed under the category of being dangerous. Specifically that title, because it's often a source for comparison based on anecdotal evidence, and they often apply a different application method, long lever, to those endorsed by you. And he's interested in seeing what the research is behind these. I'm not going to go through the rest of what he says here, because I think what I get from that is quite important. That I'm pretty sure that when you read a research paper that says there is this much danger in, I don't know, a cervical manipulation, they're possibly looking at a whole bunch of people who purport to be qualified in HVT. But you were talking in the car earlier on about doctors who've done a weekend course in HVT, whereas this lot here will do 3 years of putting it to good practice. And you get a bit better at it over 3 years, don't you?
In Australia, they tried something very interesting. They taught thrust techniques to people in the first year. And they could all do them, so they weren't looking around, and they were doing it openly, and then they decided what to use. And that works very well, and they're still doing that, because they teach them early on, not leaving it to the end, which is a crazy way of doing it. And if just sitting there at the moment, turn your head to one side as far as it'll go. So how far does it go? Goes a little bit. Now, bring it back to the centre. Side bend it a little bit. Now, leave the side bending in and try turning. How far does it go? Less far. Now, bring the head back to the centre. Side bend it. Shift your body to one side. Tip the head into slight extension. Now try turning. If you don't remove the others, it goes less far. Now try one more thing. Sitting in that position, tip the head backwards a bit, tip it to one side, tip your body that way, put your hands on either side of your neck and just try turning. How far does it go? Almost nothing. Now remove them and it goes right round. You've just used what we call minimal leverage. You've adopted a position using multiple levers, and it's that minimal leverage is. Adding every lever you can to every technique.
And you talk about the different levers, which we've got on a slide here as well, and we'll send the copies of the slides out to people afterwards. But some of the things you can't simply demonstrate sitting there. I think you've got compression in multiple directions, haven't you? Whereas traction, side shifting, all sorts of other levers which will minimise the possible potential danger. But that's of course that's cervical stuff, isn't it? And people talk about HVTs in general are dangerous. How dangerous is it if
using excessive force? There's almost no danger unless you're ancient and the bones are fragile.
All right, okay. Well, pick one of them then instead. I mean, but it's not that dangerous, is it? And you do HVTs for the knee and for all sorts of other joints, which we're going to cover a lot of this weekend, I expect, with people.
But I discovered if you're thrusting in peripheral joints, you don't thrust once. you repeat it on the spine. And if you're trying to break a piece of wood, you don't go like that. You put it there, 1, 2, then you thrust it. And exactly the same in the spine. You don't wind it up and go bang. You wind it up again and again, and you feel tension accumulating. In the peripheral joints, you can do that 9 or 10 times.
And I was never taught this at college.
No. I was in America, and I said to them, let me see somebody whose foot cannot be manipulated. And this chap hobbled out. I thought, this will be fun. And this was in front of 500 people, cameras and everything. And I took it 9 or 10 times to its limit, and bang, it went. And they, oh, it's magic. It's not magic. It's doing it 9 or 10 times. And you feel the tension increase as you're doing it.
I've often thought, though, that let's say you're manipulating a neck.
Yeah.
If you keep on turning it into your thrust position, doesn't that make the patient a bit more tense? Make them...
Yes. If you do that more than 3 times, the tension increases. And I wouldn't say you do that 5 or 6 times, because then the neck is... It's not going to tense with 3. It's not going to get tense. So stop, basically.
Yeah. Okay. George here has sent in a comment and says the accident you described is horrific. And they say, if I remember rightly, didn't an eminent cranial osteopath, who I just can't remember their name, treat you in hospital, or is that an urban myth?
No, somebody came and treated him in hospital.
That's Stuart Corth?
That was Stuart Corth,
yes,
who I was a student with. And it was he that saved my life. He got me working. Yeah. He says it wasn't him, but it was.
Who knows?
Yes.
It's a hard, isn't it? When there's n equals 1, would you have got better all by yourself?
I don't know. It's all a mystery to me.
So we talked about some of the reasons why you might do an HVT. So